I applied to 10 grad schools, which was a lot. I really wanted to be taught how to be a clinician out in the field, and I knew Pacific would do that. It's like we're dancing a little bit. These residents are in more later stages, dementia or Alzheimer's, or they have other communication breakdowns, difficulties. So we're here to help alleviate any behaviors that might be due to communication breakdowns. So we come in, offer ways for residents to be more social, engaged, and in turn, increase communication and ways that they can communicate. So we also change the way we communicate with them to better suit their needs instead of them changing to suit what we want them to do. It's kind of the whole goal. Yeah, it's a chocolate shop. That's a weakness of mine.
I have to go visit her.
So we're not peppering them with thousands of questions. Instead, we'll set up scenarios where that can allow them to contribute to the conversation, but it can also allow them not to say anything if they don't want to. Just like in a normal conversation or when we talk to people in everyday situations, you kind of offer things up. People also talk back about it, or they don't, and then you move on. Ta-da-da! It's us. So with the picture book, it's the same kind of thing. I'll mention a few things in the book, point out different things, and that'll usually then either have her ask questions about that place or also comment, and then we're having a conversation around some shared item. Another thing we were doing was putting on gloves and just kind of going for a walk. Gloves, a lot of people in this generation used to wear gloves, so it can sometimes invoke memories that they might have forgotten about. And then walking in general adds communication into your life, and you want to talk as you're walking.
3, 4.
The exercises that the residents do is put on by the activities director, but then we'll step in and try and help them communicate more during that activity or include the residents a bit more. Usually there's just one caregiver working with the residents in that. So what we try and do is get them all involved as much as possible, or just get into the social interaction piece of it a bit more. Are you pulling our chain, Spencer? Or is that just your favorite play of all time? Yeah. As we age, sometimes, not always, but our swallow can become impaired in different ways in different parts of the swallow. So, especially if you have a disease or a disorder, that can increase your risks of having a swallowing impairment. So with one of our residents, Parkinson's is involved, and that can usually slow down the swallowing mechanism anyways and decrease muscle strength as you swallow. So we work on strategies to make it so their swallow is as safe and efficient as possible, while also maintaining the highest level of independence as they eat. Do you mind if I tell you throat as you swallow?
It wasn't that much. It was only like enough for that for him. That's it.
I think we have a real learned helplessness about how to interact with patients, particularly progressive patients. And I think we've really thrown our hands up as a society and said, I don't know, you're not going to get better. And, in our culture at Pacific, we talk about changing practice, and this is part of how we're changing practice. We're starting at the local level, training these guys to change the practice, and we continue to train class after class of graduate students that's going to go out and know how to do this good work.
I can't tell you. She's the one that has gotten me so excited. I'm serious about working with this population and treating them like the adults that they are and making sure they can be as independent as possible and have a great life all the way till the end.
I'm experienced.